In the U.S., our healthcare system wastes over $500 billion of your money each year and leaves many people underinsured with huge deductibles or large copays just to guarantee massive profits for the healthcare industry. You don't have a chance of getting your money back and becoming healthcare secure if you don't understand what's wrong with our system, how to fix it, and then take action to reclaim your money. The following film will empower you to do exactly that. The annual savings for individuals could go toward retirement savings, college funding, down payment on a house, and a healthier, more secure financial life. For businesses, it means increased productivity, profitability, and less overhead and regulations, and more spending power for customers. The key to the vast waste of your dollars is the group of healthcare companies that overcharge us for their products and services. The group consists of drug companies, healthcare insurance companies, and hospitals, which together make up the largest lobbying force in Washington. You don't need that size lobbying effort unless you are protecting something expensive and rotten. It also constitutes one of the largest advertising forces in the media, hence their ability to put a gag on news coverage of cost-effective healthcare reform. As a sort of mafia with racketeering operating practices, the drug, hospital, and healthcare insurance companies have bought off our politicians and news media, including journalists, newspapers, radio, TV, magazines, even NPR and PBS. As an example, on February 4th, 2016, I watched Anderson Cooper moderate an interview with the presidential candidate. In that interview, an audience member stood up and asked what could be done about the spiraling cost of prescription drugs. As the reply about letting Medicare negotiate drug prices started, Anderson hastily cut it off with a lame, "How's the family?" The entire interaction was deleted when the video was posted to YouTube. That's the kind of power the racketeering medical mafia has in our society, turning journalists into puppets. But we need these so-called journalists to state their conflicts of interest before interviews and political debates. As you can begin to see, the healthcare stranglehold will not be overcome with anything short of a revolution by the people, businesses, and voters of this country, demanding commitments to immediate action by our politicians and transparency by the media. But how do we fight this large and powerful mafia? Healthcare now devours about 18% of our GDP, $3.2 trillion a year, growing rapidly. That means each year it takes a bigger bite out of company and individual pocketbooks. But it also squeezes down the amount of money that consumers have to spend on products like cars, houses, appliances, electronics, dining, and entertainment, crippling our economy and hurting other businesses competing for the same dollars. Most other advanced economies have figured out how to provide quality universal health care to 98% of their population by spending less than 10% of their GDP. As our video will show, the current healthcare system is backwards. We offer the best and cheapest healthcare insurance to retirees and let our vital workforce, those who are driving our economy and creating the wealth that pays for services and retiree benefits, settle for overly expensive healthcare, dragging down productivity, burdening businesses with insurance costs and regulations, and intimidating would-be entrepreneurs from creating new industries for fear of catastrophic healthcare expenses. I've recently talked to two nurses with $5,000 healthcare deductibles. How dumb are we not to take care of the people who are supposed to take care of us? This is not a partisan issue, it's simple economics. The legislation we propose might be called Americans First Healthcare Reform Act. It is the special interest burden on our economy, not China, making us less competitive and hurting employment. Politicians like to distract us by blaming things beyond their control for our problems. Don't fall for that old line. Take the time to view our video and then start the revolution to reclaim the healthcare system that you deserve and start putting money back in your pockets, for our politicians and media have abandoned you. Start by referring 20 people to this video. Barrage candidates and politicians with our demands and start campaigning within your company, industry group, chamber, lobbyist, and initiate your own social media campaign for reform. I want to thank Healthcare for All Colorado Foundation for their intellectual and financial support for this project. After the video, please check out our website for organizing information, suggested reforms, and data supporting our analyses.
I'm an emergency medicine physician. I began the practice of emergency medicine in 1976 following my graduation. As I worked in the Denver Health Emergency Department, virtually every clinical shift that I worked, I would encounter one or two patients with a very serious illness or injury. Some of them would ask me, how much is this going to cost and how am I going to pay for it because I have no health insurance? Many of them had a job, some of them more than one job. Why in the richest country in the world do we have people who are not covered by health insurance, who are going to face inordinately large medical bills and who could not pay these bills? Many of these people, I'm sure, have had to declare bankruptcy. I began to research this topic, and I then began to give presentations to, at first, medical groups and later to lay groups on our expensive, dysfunctional healthcare system. And that is what I'd like to discuss with you today. Regarding financial disclosures, I have absolutely no conflict of interest regarding anything that I'm going to discuss. I am currently president of HealthcareForAll Colorado Foundation, and I am a member of the Physicians for a National Healthcare Program. Right up front, I want to discuss a topic that a lot of our politicians espouse. We have the best healthcare system in the world, and we don't want it screwed up. Do we really have the best health care in the world in our country? The answer is both yes and no. Yes, if you are fortunate to have very good insurance and have excellent financial resources and live in a community where you can access the best physicians in the best facilities. Unfortunately, this is not true for many residents of our country. The U.S. healthcare system, when it's compared to other systems in the developed world, is actually the worst in many areas. From a system perspective, we are not first in any of these categories. This speaks to our dysfunctional, fragmented system. We are last in life expectancy when compared to 6 other countries. We have the slowest decline in preventable deaths between 1998 and 2002. We have the highest infant mortality. We have the highest maternal mortality. How many people do not have health insurance even after the implementation of Obamacare? 9.2% of our 324 million population remains without health care insurance. This is about 30 million people. Compare this to Canada, where essentially everyone has health insurance. Over 100 million go without some medical care because they either have no insurance or they are underinsured, meaning they have very high copays and deductibles and a rather low income, and they simply can't afford them. This is zero in our neighboring country, Canada. How many people die each year from not having insurance? And this was published in a peer-reviewed journal. 45,000 people per year in the US. Essentially zero in Canada. How many people are involved in medical bankruptcies each year? This is something that does not occur in any other country in the world. Over 2 million people. In fact, about 60% of personal bankruptcies are directly or indirectly related to inability to pay a high medical bill. 28% of bankruptcies are from inability to pay a medical bill alone. The remainder of bankruptcies are a combination of other issues plus a medical bill. Canada, nobody goes bankrupt because they all have adequate health insurance coverage. So how much are we spending on health care? 2015, we spent $3.2 trillion. And remember, $1 trillion is 1,000 billion dollars. It is 17.5% of our gross domestic product. It is now over $10,000 per capita. How does this compare with other nations? In 2016, we will spend over $10,000 per capita on health care. As you can see from this slide, which is a couple years old, we spend more than twice as much as most other developed countries on health care The closest nation to us is Switzerland, which spends about 60% of what we spend per capita. Since 1960, there has been a steady and steep rise in the amount of spending as a proportion of gross domestic product in the United States. In 1960, neither country had any type of government universal health care insurance. Shortly after 1960, Canada implemented Medicare in each of their provinces. And as you can see, this has dramatically slowed their spending as a proportion of GDP. Single payer implemented, and this is the difference. That is a uniquely American difference in high costs. So who pays these $3.2 trillion costs? Where does the money come from? This is very important to get a handle on this. Some of it is obvious, some of it is not so obvious. For example, everyone knows that Medicare and Medicaid are government-funded, taxpayer-funded programs. Significant amounts of money. Together, over $1 trillion. Other government health programs, such as the Public Health Service, such as U.S. military medical care, and other government-funded programs, come from taxpayer dollars. All government employees at all levels, local, state, and federal, have health insurance. This is funded by taxpayer dollars, and it's provided by private insurance companies. The VA system, overburdened and stressed recently, is over $160 billion a year now. Interestingly, the only group of people guaranteed health care under our Constitution are prisoners. If you don't provide health care to a prisoner, this could be deemed and is deemed cruel and unusual punishment. We have some people committing crimes on purpose to go to jail to get health care. Prior to Obamacare, I did see some of these folks. Public hospitals and clinics are funded by taxpayer dollars in part. For example, Denver Health, a safety net hospital, was getting a disproportionate share payment every year from the federal government to offset the care of indigent patients. Very few people realize that there is over $300 billion a year in tax deductions going to offset the premium costs of your health insurance to the employer and to the employee, funded by taxpayer dollars. This also is a regressive tax deduction. For example, I had exactly the same health insurance when I was at Denver Health as our lowest paid employers, for example, the housekeepers. I was paying less for my health insurance than they were because I was in a higher tax bracket. So I had a greater tax deduction. There's something wrong with this, something very wrong with this. An additional subsidy that came on after the passage of Obamacare in 2010 is the subsidy for low-income individuals to purchase health insurance on the Obamacare exchange. In 2015, this amounted to $76 billion and is continuing to rise. The next slide indicates how we spend this $2.9 trillion, and the majority of it goes for hospital care and to pay providers, primarily doctors. There is a growing proportion, however, that is going for prescription drugs. On this slide, it's only indicated that it's 9%. This past year, it was 13% because the huge rise in both the cost and utilization of prescription drugs, which we will discuss in some detail later. The next slide simply indicates the accelerating growth of healthcare expenditures per capita, which were just a little above $2,000 in 1990 and are now $10,000. Even after the implementation of Obamacare, when there was about 50 million people uninsured, we are now down to 20 million people uninsured. So we have managed to provide additional health insurance to 20 million people, but 30 million people still have no insurance. This is a very important slide because it gets to the root of some of our problems. It's important to know that 10% of our population consume over 60% of our healthcare dollars. 20% consume over 75%. These two deciles, the top 20%, consume 78% of the healthcare dollars. Who pays for these very expensive patients? This is primarily funded by public dollars. We need to discuss what is the fundamental goal of an insurance company or any corporation. It is to make a profit. It's not to provide health care or high-quality health care. It's to make a profit. If they don't make a profit, their stockholders are not happy and they don't stay in business. How does a health insurance company make a profit? Well, they want to manage, and they do manage the risk and maximize their profit. And in the case of healthcare, this is by insuring the healthy and avoiding the sick. This has been turned on its head by Obamacare. This is the fundamental conflict of interest in our current healthcare system. I should say health insurance system, in that insurers are very unhappy when they have to insure sick people, even though they're providing health insurance. Now, with the implementation of Obamacare, they have to insure more sick people. So the blue circle of this next slide on the right indicates the people the health insurance companies want to avoid, and in fact, most of them are covered by Medicare and Medicaid. And the green circle indicates the other 80% of our population who by and large are healthy, most of whom are working full-time and utilize very low amounts of our total healthcare dollar. I want to discuss the Millman Medical Index. This is an objective index published every year determining how much an average family spends in total on all healthcare, not just health insurance, co-pays, deductibles, over-the-counter medications, eyeglasses, hearing aids, dental care, all the things that are not paid for by traditional health insurance. In 2016, it is estimated that a family of four will spend over $25,000 a year in total health care expenditures. Of this, the bulk is going to be private insurance. $10,500 funded by the employer and $6,700 funded by the employee, over $17,000 per year. Now, most individuals have no idea this is how much they as a family are consuming of the healthcare dollar because their employer funds most of their premiums, they fund less, and they all get a tax deduction. Over $4,000 a year in out-of-pocket costs. Dental bills can be huge. Over-the-counter medications, co-pays, deductibles. Now, how does this compute when you compare it to a median household income? In other words, half the households in our country in 2015 are making less than $53,700 per year. And health insurance alone costs $17,000. There's something wrong with this picture. This index has been rising dramatically. This slide shows the gradual increase in costs and expenditures for healthcare in our country. Note that a significant portion goes for pharmacy. Obviously, the bulk go for professional services, that would be doctor and dental bills, and inpatient hospitalizations. A growing amount is going for pharmacy prescription drug costs. Why are our costs for healthcare so much more than other countries? In fact, more than twice as much as most other countries. Some might say it is because we are accessing and using more healthcare, so therefore we're spending more money. Well, that is simply not true. If you look at the fact that we spend per capita less days in the hospital than these other countries. They hospitalize patients for longer periods of time. They have more physician visits. We have the fewest physician visits compared to these other countries. And so we are not spending more on health care because we are using more health care. Compared to developed nations, we spend twice as much per capita on health care. We have over 30 million people uninsured. We have 50 million people underinsured. In other words, they can't afford to pay a copay or a deductible because their income is not high enough. We continue to risk and have personal medical bankruptcy, and we have dismal outcomes in terms of quality when compared to other countries. Almost $900 billion and approaching $1 trillion a year can be attributed to waste, fraud, and abuse in our healthcare system. Waste is the misuse or overuse of resources, resulting in funding of unnecessary costs. So what are some examples of waste? Performance of unnecessary tests and procedures. Too many hospitals with excess numbers of unfilled beds. This costs money, and this money comes from our healthcare dollars. Duplication of expensive technology, CT scans, MRIs. We have far too many of these, and some are underutilized, but they are expensive. We have too many overpaid administrators in both the health insurance industry and in the hospital industry. We have a huge outlay of dollars for lobbying from the medical industrial complex. In 2012, the Institute of Medicine, in their report, estimated that $750 billion are wasted annually in our healthcare system. Now, the Institute of Medicine is a very objective, unbiased group of some of the finest physicians in the country who periodically do white papers. What is the cost of this waste? There are estimates that are ranges for obvious reasons. The Rand Corporation estimates that 476 to 992 billion of the 2.6 trillion in 2011 were costs of waste. So now their estimate would be over $1 trillion. The Center for Medicaid Services, which administers Medicare and Medicaid, estimate that between 166 and 304 billion dollars are wasted. There is almost $100 billion wasted because of inefficient and redundant medical administrative practices. A very reputable paper, peer-reviewed in the last year, estimates that $376 billion per year is paid for billing and collecting on the part of doctors, hospitals, and insurance companies. Each doctor and hospital has to negotiate with a myriad of private insurance companies to determine what their reimbursements would be. Doctors have to get permissions from insurance companies for procedures and diagnostic studies. Then they have to generate bills. The insurance companies do their best to keep their costs down by minimizing what they reimburse hospitals and doctors. There are often conflicts over this, and that is more administrative time and paperwork to get them resolved. In fact, it's estimated that it costs the average private practicing physician $84,000 in office overhead to do billing and collecting. It costs the average hospital significant amounts of money to do this as well. In the U.S. hospitals, overhead is estimated to be 25% of their total budget. This is twice as much as any other hospital in any other country on average. Private insurance overhead is between 15 and more commonly 20%, and in fact, this overhead is limited to 20% now by Obamacare. Compare this to standard Medicare, where the overhead for managing Medicare, processing and paying the bills is between 3 and 5%. Medicare Advantage, about 1/4 or more of our citizens on Medicare are covered by Medicare Advantage. This basically is a private insurance plan funded by Medicare dollars, but not just funded by the same dollars Medicare would pay to cover the same costs for an individual, but subsidizing the private insurance company by at least 17% over and above what it costs traditional Medicare. The insurance companies not only get these per capita monthly payments, but in addition, they've managed to negotiate 17% beyond these costs. And in fact, it's even more than that when we talk about Medicare risk adjustment. The administrative overhead for Obamacare is significant. And then, of course, we have Medicare Part D insurance, which is the prescription drug coverage from Medicare. This plan was essentially written by the pharmaceutical industry with the help of the medical insurance industry. It prohibits Medicare from negotiating prescription drug prices. The VA system and all private insurers negotiate drug prices. So do every other country in the world. It also prohibits reimportation of drugs from Canada, where they purchase the same medications for 50 to 60% of our costs. And it also does something very strange. It is a prescription drug plan funded by Medicare, but you can't take your Medicare card and your doctor's prescription and go to your local pharmacy and get it filled for your medication. You have to contract with a private insurance company to get this accomplished. This is the cut that the private insurance industry managed to insert into the Medicare Part D bill. This is an outrage. This is a gross waste of money, and it must be stopped. 1/3 of our healthcare dollar doesn't go to healthcare. It goes for administrative overhead and profit. An excellent article published in Time magazine in February of 2013 by Stephen Brill, titled "Bitter Pill: Why Medical Costs Are Killing Us," is highly recommended to each of you. This took up the entire publication of Time magazine at that time. In this, he goes through in some detail the exorbitant costs of being hospitalized and the incredible charges that are incurred by patients. Most people never experience a very expensive hospitalization and hospital bill. U.S. physicians spend at least 4 times more than their Canadian counterparts just in interacting with insurance companies and doing billing and collecting. This was from 2015. And in fact, in this article, they state that in the Denver area, the bed occupancy rate is only 62%. We keep building more hospitals. This slide shows the growth of administrators compared to physicians. There is a tremendous growth compared to physicians and nurses, and this consumes a huge portion of our healthcare dollar. This is because of the billing, collecting, the managed care emphasis, the HMOs, the hospital administrators, the huge increase in the growth of administrators compared to caregivers, physicians, and also nurses since 1970. This consumes huge amounts of our healthcare dollar, and these folks provide no healthcare. Obamacare, the Affordable Care Act, is adding billions to healthcare because of their bureaucratic waste. Each of these boxes consume huge amounts of money, all funded by taxpayers. $1,450 compared to only $147 by traditional Medicare. This is a welfare program funded by Medicare for private insurance companies. These high overhead costs were supposed to gradually go away with the implementation of Obamacare, and in fact they have not gone away, they've actually increased. Audits of some Medicare Advantage plans reveal pervasive overcharging. In addition to this administrative overhead subsidy, Medicare Advantage plans get increased per capita payments based upon how healthy or how sick each covered person is. And this is called risk adjustment. Many games are being played to inflate these numbers. For example, a patient could have chronic low-level arthritis requiring essentially no care, but is coded as arthritis, and this helps increase the private insurance monthly per capita payments. Overall administrative costs in our system compared to Canada is essentially $3,000 for the US, $790 for Canadians. And there is a lot of money in waste and abuse in this administrative cost number. The health insurance lobby keeps Medicare Advantage overpayments flowing. The reason why Medicare Advantage administrative payments did not go away is because of the power of the health insurance lobby. What is fraud? Well, it's knowingly making a false statement or claim that results in funding of an unauthorized benefit. Who are the major perpetrators of fraud? They're hospitals and drug companies and medical providers. What are the consequences of these companies or individuals perpetrating fraud? Basically, the more fraud you perpetrate, the more it costs. You only have a monetary penalty. It's the people who perpetrate lower levels of fraud who go to jail. The big guys are too big to jail. There are monetary penalties alone, and these are not sufficient to curtail fraud to any great degree. Examples of fraud: And this is usually upcoding. In other words, charging more for a given procedure than they could justify based on what they did or based on the medical record. A big one is in prescription drug marketing and prescribing. Kickbacks to providers, fraudulent ambulance billing, fraudulent billing for medical devices, sometimes never provided, and for home health care billing, often never provided. Hospice, home health, and long-term health care scams. This is on the rise. With the advent of Obamacare, there has been funds in that bill to enable the Department of Justice to aggressively pursue Medicare fraud. And in fact, just recently, they've uncovered a $3 billion fraudulent billing scam in Florida. Pharmaceutical fraud is rampant and ongoing. These are some of the largest fines levied against drug firms, and they range from $3 billion to $109 million just in the year 2012 alone. These huge fines are viewed by the pharmaceutical companies as simply the cost of doing business. In fact, huge fines, settlements, and lawsuits are all part of their routine business. In fact, pharma fraud settlements are simply monetary payouts, a rather small proportion of the amount of money they brought in because of the fraud. In comparison to private individuals committing fraud, where they are not only charged and often convicted of a criminal offense and face jail time, they are also expected and mandated to reimburse the money they fraudulently obtained. This is not true with hospitals and insurance companies. They pay the ticket and they keep on speeding. DaVita had to pay a fine of $389 million. DaVita is one of the two largest hemodialysis companies in the U.S., headquartered in Denver. They have 1,900 renal dialysis centers in our country. Their first fine for fraud was $55 million, and this came from a nurse whistleblower indicating that they were inappropriately and fraudulently using the drug Epigen, commonly called EPO. A little later, they were hit with $389 million in civil and criminal fines for kickbacks to kidney doctors or nephrologists via 28 joint ventures involving dialysis clinics. Why is dialysis so profitable? Most people don't realize that there is a provision added to Medicare that Medicare will pay for any person on dialysis regardless of age, unless they're an undocumented immigrant. This is a huge business consumed by two large corporations that provide about 80% of the dialysis in our country. Guess how many people are going to jail because of this civil and criminal behavior on the part of DaVita? As far as I can determine, nobody's going to jail. The doctors were neither sanctioned or found guilty of anything. Another recent scam revealed $1 billion in alleged Medicare fraud. The flagship case came in 2003 when Columbia Healthcare Corporation, now called Healthcare Corporation of America, was hit with a $1.7 billion fine for fraudulent Medicare billing. This was a huge amount of money back then. This is a for-profit hospital corporation. The CEO of this corporation, upon retirement shortly thereafter, received $10 million in severance and $300 million in stock. In fact, in his deposition on this case, I believe he took the Fifth Amendment 75 times, and he claimed he knew nothing about his underlings committing this fraud throughout the United States in their many hospitals. He was, after all, just the CEO. Now, who is this guy? Well, you may recognize his name, Rick Scott. He is now the governor of Florida. Not only was he involved in this Columbia Hospital fraud settlement, but he has blocked the implementation of Medicaid under Obamacare in Florida, keeping over 1 million low-income Floridians without health insurance and access to health care. An increasing area for fraud is hospices. There is a lot of fraudulent billing going on, large number of patients getting admitted and discharged perfectly alive after 6 months. And one of the criteria for hospice is the clear majority of patients are probably going to die within 6 months. Abuse in healthcare. What is it? It's provider practices that are inconsistent with sound fiscal, business, or medical practice that result in unnecessary or exorbitant costs to the patient or the insurer or the payer. This is not illegal. This is a legal practice, but it is rampant. Prescription drug charges. Everyone is familiar with this just by watching the news or reading the newspaper. Hospital, hospice, and long-term care charges. A hospital and a drug company can simply charge whatever they want. Hospitals can do this in most cases, except in a few states where there are some limitations. Drug companies have no limitations. Medical device and equipment charges. Again, they can charge whatever they like. And they are protected in many instances by a patent. So if they are the only company that has this device or this drug, they can charge whatever they want and there is no competition. Certainly medical provider charges. There have been some doctors convicted of fraud for not only overbilling, but usually billing for procedures that they never did. And of course, there are the overpaid CEOs and administrators that are nicely discussed in the Brill article that I alluded to earlier. This gets to be more interesting when we talk about HMO CEO's pay. Particularly Stephen Helmsley, who is the CEO of United Healthcare, which is one of the largest private insurance companies. In 2012, his annual pay was $14 million. In 2014, Stephen Helmsley's pay was up to $66 million. Where do these salaries and stock options for CEOs in HMOs and in health insurance companies come from? In health insurance companies, they come directly from premiums paid for health insurance. And this is money that is not being used for health care. The granddaddy of them all in this regard was a person named William McGuire, who was an early CEO of United Healthcare back in the 90s and early 2000s, when United was gobbling up a lot of small private insurance companies and became a giant company. When he left the company, he left with stock options worth $1.8 billion, that's with a B, dollars. The Securities and Exchange Commission made him give back $0.4 billion. So the poor guy only left with $1.2 billion. All this money came from health insurance premiums. In regard to prescription drugs, there is a nice book written for the lay public by Marcia Angel, former editor of the New England Journal, called The Truth About Drug Companies, How They Deceive Us and What to Do About It. I encourage you to read it. It's several years old, but virtually everything that's in there applies to what's going on today. This shows the U.S. prescription drug spending and how rapidly it has increased. Notice from this slide that this curve, this increase took off dramatically in the mid-90s. And in fact, in 2016, it will probably reach about $400 billion a year. Why did it take off so dramatically in the mid-90s? Prior to the mid-90s, it was illegal for drug companies to advertise prescription medications. So there was nothing on TV, the radio, magazines, or the internet directed toward consumers or patients. They got Congress and the FDA to agree to lift that restriction. And after that, the expenditure for prescription drugs soared because the demand soared. Think about these commercials that you see every day, multiple times a day. They're not advertising cheap generic drugs. They are advertising the most expensive brand name drugs. And so Mrs. Jones is on aspirin, one a day, to prevent a heart attack or a stroke. She sees the commercial for Plavix, and she goes to her doctor and says, "Isn't this Plavix much better than the aspirin I'm taking?" And her doctor says, "Well, aspirin is a penny a day, and Plavix is $4 a day." And she said, "That's okay, I have health insurance, and I'll pay the little bit more copay for the brand name drug." And the physician, because of patient pressure, often writes the prescription, even though some of the time this medication is not even indicated. The providers, in many instances, get their education about new drugs from drug salesmen. And I submit that this is a conflict of interest, to get your education about a new drug from the sales representative. But unfortunately, that does happen. The drug companies use the worst side effects to market the drug. Think about Viagra. I swear that anybody who watches an NFL football game is impotent. That's all they advertise. And they use the worst side effects to market the drug. If you start to go blind and deaf, or if you have an erection lasting longer than 4 hours, call your doctor. What do you think Joe Sixpack says when he sees that? Wow, 4-hour erection? Where can I get some of that? Well, I've seen some 4-hour erections, and these guys were not having a good time. This shows the drug companies' cost structure. One of the reasons drug companies give to justify the high cost of prescription drugs is because if they can't charge these high costs, they can never discover a new drug because research is expensive. Well, if you look at this, they only spend 13% of their total budget on research and development. They spend 35% on marketing, which is more than they spend to manufacture the drug. Their profits are 18%. So if they only spend 13% on research and development, who do you think discovers and pays for new drugs? 85% of new drugs are discovered by non-pharmaceutical company researchers, usually in medical schools and universities, and these are often funded by NIH taxpayer grants. So the university researcher discovers a new drug, the pharmaceutical company is very interested, they buy the patent from the person who discovers it, who makes a lot of money, and they take that and do the clinical trials to get approval from the FDA. Research and development is really funded by taxpayers, not by pharmaceutical companies. This is a very interesting slide. It shows you the profits of pharmaceutical manufacturers compared to the profits of the average Fortune 500 company. You can see the pharmaceutical profits are 3 to 4 times or more the profits of the average Fortune 500 company. One of the strongest lobbies in our country, they are very good at keeping these profits intact. Now, epinephrine is a generic drug that has been on the market for years for about $10. And then you draw it up with a syringe and a needle and you inject it into the patient's muscle. So what about the EpiPen? Well, they put the epinephrine in an automatic injector. And the one company in the US has the patent for the auto injector. And that is for a layperson to simply hit his thigh even with your pants on, and the spring-loaded auto-injector puts the needle into the muscle and discharges the medication. This used to cost about $60 for 2 EpiPens. A new company got control of this market and they raised the price to $600 for 2 EpiPens. Not only that, they very cleverly marketed EpiPens and went to every school in the US and said, you need to stock these in your school in case a child has a serious allergic reaction, and then you could administer epinephrine because minutes make a difference, could be life-saving. Schools have started to buy it and the market has gone up. A child with a peanut allergy, this could be life-threatening. And so the family buys EpiPens and has one with the child at all times in case he has an allergic reaction. It gets even better. They put an expiration on these, I believe it's a year. So they say in a year, the drug has expired and you need to buy new EpiPens. This is a life-saving drug. Families are forced to make decisions. Am I going to buy an EpiPen or am I going to put food on the table? This should not be a decision that they have to make. This is just price gouging by greedy pharmaceutical companies, and they do it because they can. Now, with the public outrage and even Congress sort of getting involved, which is interesting because the CEO of this company is the daughter of a senator, they've decided to cut the price in half. Here's a taxpayer-funded life-saving new drug from Gilead Sciences. And this is Sovaldi, which is a drug to treat hepatitis C, which is a very serious liver disease. It can be now treated with medication. But because Sovaldi has the only drug available and has a patent on this, they are charging $84,000 for a single course of this medication, which is an 84-day course. 1 pill a day, $1,000 a pill. And they justify it by saying, well, if we could cure patients with hepatitis, fewer of them will need liver transplants. Well, the problem is there are many people with hepatitis C that can't afford this medication, even with insurance, because insurance companies have boosted this to a Tier 4 drug. One private insurer in Colorado says, we will cover the cost of this drug. You will pay $33,000 and we'll pay the rest. Who's got $33,000 lying around that they can come up with to pay for this course of treatment? And it costs a small number of dollars to manufacture each of those pills. Hedge fund managers have gotten into the act. They've been buying up generic pharmaceutical companies, many of whom are the only manufacturers of certain generic drugs that have been very inexpensive. And once they have control of the company, they simply raise the price. Here's an anti-parasitic medication that was priced at $13.50 a tablet, and it was raised to $750 overnight by a hedge fund guy who got control of the company. They did it because they could. This would be Teddy Roosevelt's solution to solving this problem with price gouging from pharmaceutical companies. It's time to consider nationalizing the greedy pharmaceutical industry. They have to be reined in, and we have to have strong action on the part of Congress to be able to do this. Hospital charges. Are they based on actual costs? What is the charge master? Can I see the charge master to determine how much my care will cost? Well, the charge master is this big book each hospital has with all of their charges, but the public doesn't have access to it. Every procedure, every medication, every bandage, they charge individually for each of these, and they're on the charge master. And hospitals, like drug companies, charge excessive amounts because they can. Let me give you an example. My wife had surgery last year. I demanded her itemized bill. On that bill, they charged for a basic metabolic panel, which is basically a blood test that's automated. Hundreds of them are done every day in every hospital. Their charge for that was $373 for that one test. They had to draw the blood, send it to the lab, and run the test. Medicare would pay about $16. The poor guy with no insurance gets the full bill. In that regard, I refer you back to the Bitter Pill article by Stephen Brill. There's an interesting site on the web that calculates hospital charge-to-cost ratios. And this slide simply shows the dramatic increase in what the hospitals charge compared to what it actually costs. They use facility fees to inflate hospital prices for common services. They claim that they have a huge overhead to run their hospital, and they have to add this on to the cost of your bill. And also they claim they're providing huge amounts of indigent care, and they have to inflate their prices. 50 hospitals in the country charge the uninsured more than 10 times the cost of care. Now you notice Colorado is not on this slide, so we're not in the top 50, but we're pretty high up here. Here is the Colorado Hospital top 10 in charge-to-cost ratios. The most expensive hospital charge-to-cost ratio is 7-to-1. It goes down to 4.8-to-1 for number 10. You'll note in this slide, virtually all of the for-profit hospitals in Colorado are in the top 10, almost all of them. Here is just a stunning example of how outrageous these hospital charges can be. This is the charges for a laparoscopic appendectomy, which is a straightforward surgical procedure for acute appendicitis. Usually a young, healthy person has abdominal pain. It's persistent. They come to the emergency department. We make the diagnosis, sometimes having to do a CAT scan, hopefully not, but often we do. Referred to a surgeon. Patient gets admitted, goes to surgery, has a procedure through a small scope with some small incisions. The appendix is removed. Patient goes home the next day. This is only the hospital charges, and you can see the range from a small rural mountain hospital where it's $15,500 to one of the suburban Denver hospitals where it's $93,000. Now put yourself in the shoes of an individual who, for whatever reason, we're going to discuss those later, does not have health insurance. They show up at that expensive hospital, have this procedure, and end up with a bill of over $90,000. Here is an interesting headline. The Council for Affordable Health Insurers are arguing that hospital pricing is the outrage of our time. So this is the insurance companies complaining about hospital charges. A lot of people have said, if we could solve our malpractice problem, there are too many malpractice suits, too many lawyers suing doctors. If we could control this, we could greatly control hospital costs. Malpractice is an issue, but let's look at the real costs. In 2015, the total cost for malpractice settlements was about $4 billion. It is estimated that the total cost for malpractice, cost of malpractice insurance premiums, the litigation, the legal fees, expert witness fees, and defensive medicine practice is about 3% of our total healthcare dollar, or $90 billion. But in proportion to the $3.2 trillion, it's only about 3%. So even if we could reform this and get that number down, it would not make a huge difference. I want to switch gears and talk about the Patient Protection and Affordable Care Act, known as Obamacare. The goals of Obamacare, which are laudable, is to provide universal access to health care, contain health care costs, make health care affordable to everyone, and improve the quality of care. When Obamacare was being negotiated in the Senate and House in 2009, President Obama, newly in office, had to make a choice. He said he didn't want to start from scratch. So he had two fundamental choices: to build on the public sector, i.e. Medicare, or to build on the private sector, i.e. private health insurance. Which did he choose? Well, for political reasons, he chose to build on the private health insurance. Again, the fundamental goal of a private insurance company: make a profit, insure the healthy, and avoid the sick. And you can see from this same slide we showed earlier, the green circle, which is 80% of the healthy people. Many of these individuals were working, had reasonable incomes, but chose not to buy health insurance because they were healthy or because they couldn't afford it because their incomes were too low. So the health insurers agreed to the stipulations under Obamacare because it mandates everyone buy insurance, and they wanted to get the healthy people paying premiums, which they believed would then offset the increased cost for the sick people that would enroll in Obamacare. Now, this act has some very, very good and long overdue provisions. And what are these? It prohibits rescissions. What is rescission? Rescission was a practice of private health insurance companies by going back and scanning one's medical record with a fine-tooth comb if you develop an expensive illness, for example, breast cancer, and saying when you were 15, you were on a prescription drug for acne and you didn't list this in your original application for our health insurance, and so therefore we deny your coverage and we deny your health insurance. That was rescission. That is no longer allowed. $1 million in this health insurance market now is not a lot of money. Often people had a cap of $1 million. Once that cap was reached, they were completely and totally responsible for all their bills. It requires free preventative health services, so there's no copays for mammograms, for pap smears, for colonoscopies, all of the preventative care that everyone should have, which then keeps you from developing serious diseases later in many instances, or discovers them early when they're treatable. It extended to coverage for children under 26. They could stay on their family policy. Overnight, this resulted in about 2 million more people under 26 obtaining health insurance. It expanded primary care and community health centers. Insurance companies could no longer deny insurance coverage for pre-existing conditions. Before the passage of Obamacare, unless you were getting your insurance through an employer, the health insurance companies would get a medical history from you, and if you had any significant illness or injury, they simply would not sell you insurance. In fact, sometimes they wouldn't sell you insurance just because you were age 50 or age 55. Now they can't refuse to sell insurance to anyone. It limits the insurance overhead to 20%. In other words, for every dollar in premiums, it mandates that the insurance company must pay out at least 80 cents for health care. The first year this provision was in effect, insurance companies had to rebate a total of almost $2 billion to premium payers that year. Since then, they've essentially rebated nothing because they've learned how to do the accounting. It decreases the cost of medications when you're in the Medicare donut hole, and I don't have time to go into that. That's another crazy provision in the Part D Medicare law. Private insurance subsidies. In other words, this law said that if you have a low income, health insurance premiums are expensive and we will subsidize them, and they are up to 400% of federal poverty. So that basically is, for an individual, about $11,500 a year, and for a family, $46,000 a year. If you are below those numbers, you qualify for Medicaid. And if you go above the number of $94,000 for a family, you no longer qualify for a subsidy. And these subsidies are progressive. In other words, the lower the income, the greater the subsidy. So someone making $20,000 a year may have 80% subsidy of their premium. Incomes at the high end may only get 10 or 15% subsidy. And it expands Medicaid. This is a big one, to 138% of the federal poverty level, which is essentially $16,000 for an individual, $32,000 for a family. Let's talk about the Obamacare subsidies. Again, they are available if your income is between 138% and 400% of poverty. And incomes below 138% of poverty are only eligible for Medicaid. Why is this important? If you live in a state, one of 19, where your governor and legislature has decided not to expand Medicare, even if you want to, you can't buy Obamacare insurance with a subsidy. You are prohibited from doing that. So in essence, you have no way to get health insurance. When they put the law in, they said, how are we going to get people to buy insurance? They said, well, we'll create penalties. What they did is they created very low penalties compared to the cost of insurance. For example, if you're a single person making $50,000 in 2016, your penalty is only $996. Contrast this to your health insurance premium, which could be about $7,000, unless you live in a county like in Colorado where Aspen and Vail exist, where your premium will be 2 times or more. So you're healthy, you're going to make a decision. I'll pay a $1,000 penalty, I'll avoid $7,000 to $15,000 a year from my health insurance, and I'll go without. If you are married with 2 children and your income exceeds $94,000, for example, you make $100,000, your penalty is only $2,085, and your health insurance premium is going to be about $17,000 if you are buying it yourself. So that's the trade-off. What are the shortcomings of Obamacare? Well, it still leaves almost 30 million people uninsured. It really has not decreased medical costs significantly at all. It increases the cost of federal and state bureaucracies to manage these private insurance plans under Obamacare. It excludes undocumented immigrants who still require medical care, and when they do, they usually are sick and they show up in an emergency department because they couldn't get preventative care for their diabetes or ongoing care. They didn't get prenatal care, so they have premature infants with all kinds of complications because they are excluded from Obamacare. There are still 6 million Medicaid eligible who are uncovered, and it leaves many, many people underinsured, can't afford copays or deductibles. It will not and has not eliminated medical bankruptcy. It's decreased it, but by a small amount. And it will not and has not controlled rising premiums. A misunderstanding on the part of many is that the government sets your premium. The government does not. Private insurance companies set the premiums. And it will not generate enough revenue to offset their increasing costs. Other unintended consequences, it encourages employers who are employing low-wage workers, if they have health insurance for them, to relinquish it. If you're a small employer with under 50 employees, you don't have to provide health insurance. So they encourage their employees to buy health insurance under Obamacare and get the government subsidy. And the employer pays nothing, and the government subsidizes the insurance. Walmart is well known for having employees who work less than 30 hours a week, where they don't have to pay any healthcare insurance costs because you're not a full-time worker. Small employers, I just mentioned, will be dropping health insurance in favor of federal subsidies. The low penalties have encouraged many healthy not to buy the insurance. But of course, if you're sick, you need the insurance and you're going to buy it. Lately, insurers are dropping out of exchanges because they say their costs are too high and they no longer will offer insurance. In fact, there are some states where there's only one insurer or only two insurers. There are certain locations in many states where there may be no insurers or only one. So there is no choice. These 5 to 6 million eligible for Medicaid will be uninsured because of the refusal of 19 states to participate. Obamacare in the law said that if you expand your Medicaid covered population to 138% of poverty, the federal government will pay 100% of the increased cost until I believe 2020 or 2021, when it will go down to 90%. Why wouldn't a state government say that's a good deal for our people? Federal government's paying for it, we get more people insured, but they choose not to. Another unintended consequence of Obamacare is that in order for private insurance companies to control costs, they are limiting their choices. Choice of doctor, choice of hospitals. They're increasing their copays and deductibles. The problem they're facing is the sick are buying in, the healthy are staying out, their costs are going up, profits therefore are going down. This basically shows the number of states in which the governor and the legislature have chosen not to expand Medicaid. This is a national shame. This is only done for political reasons, from what I can tell, and they care nothing about access and insurance for very low-income individuals. And people are dying because of this. The new threat is insurers pulling out of Obamacare, and if they're not pulling out, if they're the only insurer left in a given region, they can charge whatever high premiums they want. This is a very important slide that I think is often overlooked. If you look at the tremendous increase in the cost of health insurance premiums, which is the top line, compared to the increase in inflation and wages, you see inflation and wages over the 25-year period have risen very little. Healthcare premiums have accelerated dramatically, and this is one of the clear reasons why wages have been flat. Employers are having to pay more for health insurance, so the trade-off is, do they continue to provide the health insurance or they give someone an increase in wages? And they have been choosing to provide health insurance at the expense of wage increases. Basically shows how dramatically healthcare costs are going up in comparison to incomes. And this is an unsustainable rise. Millions will remain uninsured even after the advent of Obamacare. And we have an increasing problem with underinsurance and rising deductibles and copays. Even middle-class families can't come up with a $5,000 deductible if somebody gets sick. Because of this underinsurance, Americans are struggling to pay for these massive health care bills. Even if they're insured, they could have a deductible of $5,000. By law, it is limited, but it could go up approaching $10,000 for the family, and most families simply don't have that kind of cash in savings to be able to afford an unexpected medical illness or injury. I need to point out that medical bankruptcy has some fallacies out there. People think it's people who simply choose not to have health insurance and can't afford it, or there are people who simply are the down and out homeless kind of folks. Well, that's not true. Studies have shown that most people who go medically bankrupt have had private insurance or who have private insurance. In the past, they've had it, it ran out, they lost their job, they declared bankruptcy. Now it's happening because of high copays and deductibles. This slide reveals the dramatic increase in health insurance premiums for both a single person and a family over the years. It is now reaching an unsustainable level. This next slide basically shows the projected health insurance premium cost, and they will continue to go up and may rise dramatically in the next several years for a variety of reasons that we don't have the time to go into here. The reason people are remaining uninsured is they simply can't afford to buy health insurance, even with a subsidy in many instances. This front page from The Lancet, which is a very respected British medical journal, kind of says it all in that health reform in the U.S., the process exposed how corporate influence renders the U.S. government incapable of making policy on the basis of evidence and the public interest. In other other words, we are so strongly influenced by the corporate special interests that we can't do what's right. And that's because of the medical industrial complex. Remember, what they consider healthcare income, we consider healthcare costs. And I consider much of it waste and abuse. Who are the medical industrial complex? Well, the big players are obvious. The health insurance companies, the hospitals, medical device manufacturers, certainly the pharmaceutical industry, and providers. Lobbying expenditures are huge. In fact, from this slide you can see the medical industrial complex compared to the other special interest lobbies such as fossil fuels, other insurance companies. The medical industrial complex spends far more on lobbying. This slide is very interesting because it shows the return on investment for lobbying. An interesting study came from the amount of lobbying in 2009 during the formulation of the Patient Protection and Affordable Care Act. At the peak of that year, there were 4,500 lobbyists working on this in Washington, D.C., which was 8 times as many as the total members of Congress. They really went all out, spending all kinds of money to be able to essentially write the law the way they wanted it written. The same deal with the pharmaceutical industry, one of the strongest lobbies in Washington, D.C. At the height of Obamacare, they were spending $1.4 million a day in lobbying. This slide illustrates, in a cartoon fashion, the problem in reforming healthcare. So is our current health insurance system sustainable? If not, what are the long-term solutions? I submit to you it is not sustainable for the reasons we've discussed at length. Let's look at solutions. I think to look at a solution in terms of health insurance, we need to ask what are the attributes of the ideal health insurance plan. And this came from a committee I was on at the Colorado Medical Society, where we basically sat down and said, what would the ideal health insurance plan look like? Obviously, it should be affordable. If you can't afford it, you can't get it. And if it's affordable, everyone should be able to get health insurance. To make it affordable, there should be minimal copays and deductibles for everything except preventative care. It should be comprehensive. It should cover all care from prenatal to end-of-life care. It should be universal. In other words, it should insure everybody. It should not be tied to your employment. It would cover you if you're between jobs, if you're at a job where they're not offering health insurance, or if you're simply not working for whatever reason. It should be portable. You ought to be able to take it anywhere in the U.S. The quality or the access to health insurance should not be dependent upon where you live. And you should have unrestricted choice of doctor and hospital. This is a big criticism we hear from many of our political leaders in regard to government insurance. It's going to restrict your choice of provider and hospital. I submit to you, Medicare, traditional Medicare, allows you to go to any doctor or hospital who accepts Medicare. The restrictions come from your private insurance company. That's who restricts choice. So how do we attain the ideal? Obviously, it should be a federal legislative fix. The simplest and most straightforward way to do it would be to take a program that works for the sickest amongst us, Medicare, and expand it from 65 down to age 0, and it would cover everybody. And it would bring into the risk pool all of those healthy people. It would reduce administrative overhead from more than 20% down to 3 or 4%. It would control costs. They could mandate global-based budgeting for hospitals. It could institute certificate of needs for new building and capital equipment. Importantly, they could negotiate the cost of prescription drugs because they are the single biggest buyer of prescription drugs. This is done province to province in Canada, where they negotiate the price of prescription drugs, and they get these for half or 60% of what we pay for them. Negotiate medical device and durable goods pricing. Set uniform reimbursement rates for all providers. There would be transparency because you would know what the charges are, who's charging, and how much. This could all be public knowledge, and it should be funded through fair and progressive taxes or insurance premiums. In fact, Medicare is a progressive premium funded program in part because the more you make as a Medicare recipient, the higher your premiums are. And this would also go a long way to eliminating most of the waste and abuse and much of the fraud. A good book I recommend in this regard is by John Gaiman. I think there is going to come a day when this is inevitable. This is going to be the most cost-effective only way to control costs and ensure everyone and provide quality of care. The demagogues will be out in force. And what are some of the things they're going to be saying? Well, we're going to be back to killing grandma again and rationing health care. That came from a provision in Obamacare that simply stated doctors to actually get paid for sitting down with their patients and discussing in detail living wills, advance directives, and what they did or did not want at the end of life or if they had a terminal illness. This was turned around and said this is rationing of health care, this is encouraging us to kill grandma, and nothing could be further from the truth. We have to stop the demagoguery. This should not be a partisan issue. This should be a human issue of what's right. The other big argument is going to be this is socialized medicine. The government is taking over. Uncle Sam is going to be in your exam room when you're getting a pelvic exam. I mean, there was a commercial with that in it not long ago. This is not socialized medicine. People don't understand what they're talking about. Socialized medicine is when the government owns the facilities, that is all the hospitals and clinics, and all the providers, doctors, nurses, everyone else, are government employees. What we're talking about is a social insurance program that already exists in which the government collects the money, collects the premiums, and then pays for the private practice of medicine and reimburses the providers and hospitals. So this is not a government takeover. Next argument they're going to make is the government's going to tell you which doctor and hospital you could go to. That is absolutely untrue. That happens only with private insurance companies. Next one is there's going to be excessive waits for procedures. We're going to be waiting in line. We're not going to be able to get anything done. There are some waits in Canada, and it's because they have far fewer specialists and technology than we have. That is not a problem in the US. And in fact, it's better to wait a short time to get an elective procedure than to not be allowed to get in line at all because you have no insurance and can't afford it. And in fact, even with good insurance, there are waits for elective procedures in the US. And finally, the government can't do anything right, but don't take my Medicare away from me, is a summary of what we've just talked about. And this is coming. And why is it coming? Because the special interests are going to be out in force. Remember that $1 trillion that goes for administration and profit, and a significant amount of that is waste and abuse? If that goes away, their high incomes, their high profits, their high salaries will go away as well. And they're not going to go away quietly. The winners are all residents of the US, all providers, because now they'll have guaranteed payment. There'll be no bad debt. There'll be no negotiating with insurance companies to get the bill paid. Businesses, they're huge cost savings for businesses. They don't have to negotiate with insurance companies every year and determine how much their premiums are going to be for their employees. There'll be no more medical bankruptcies. Lower income individuals will benefit the most, because right now we ration health care by socioeconomic status. People with low incomes have less access to medical care and have less procedures and less care simply because they can't afford it in compared to higher income individuals. And we should improve hospice, end-of-life care, and mental health care. The losers, pharmaceutical profits, but they're still going to go on and survive. They'll be able to buy shoes for their kids. Private insurance companies, they will essentially go away because they will not be providing basic insurance. They could still offer secondary insurance, just like they do now, secondary insurance for traditional Medicare, if people choose to purchase it. But they will not be providing basic health insurance. For-profit providers and CEOs' incomes are obviously going to take a hit. The overpaid administrators in hospitals and insurance companies and elsewhere will take a hit. The medical industrial complex, overhead and profits will take a hit. This is a problem because the contributions from the medical industrial complex lobbyists to legislators will probably go down somewhat. It strengthens American businesses. This is really important. because it reduces business costs for health insurance. You know exactly what it's going to cost you each year for health insurance. There's no rise in premiums because somebody got sick last year with a huge medical cost. Then they raise everybody's premiums for your company. That goes away. Workers' comp will be covered. You won't have to pay separate insurance for this. Employers will no longer have to be responsible for retiree health benefits, many of which have been negotiated in the past and are very difficult to sustain into the future. That goes away because these people will be covered. It'll cost businesses less to have their employees insured. And this is a good thing. It makes businesses much more competitive. For example, Toyota chose to build a new assembly plant in Ontario across the border from Detroit rather than in the US. And the reason they gave is because of the huge cost of health insurance in the US since it's covered by the tax system in Canada. It levels the global playing field for businesses. In summary, we as a country must make a decision. Are we willing to do what every other developed country in the world has done and develop a system where we cover everybody for basic health insurance? Or are we going to continue to go on with this dysfunctional, expensive, fragmented system that leaves millions of people uninsured and underinsured? To do this, we need comprehensive healthcare reform. The whole reason for this talk is to educate people with the facts. You got to be educated as to what the real issues are here. Follow the money. Look at the issues. So educate your friends and neighbors. Continue to educate yourself because this is an evolving issue. There's something new every day on it. Join organizations that advocate to expand healthcare to cover everyone, such as HealthcareForAll Colorado. If you're a medical provider, a nurse, or a physician, join Physicians for a National Healthcare Program. They are advocates for single-payer Medicare for all system. But most importantly, lobby your elected officials and representatives. The only thing that can trump the huge special interest dollars is your vote. And when enough people can't afford health insurance or basic health care, something will be done, and it will only be done by pressure on your elected officials. And finally, question and push back against excessive charges and abuses in the system. We need to stand up and make people accountable for these huge charges that they impose on people for sometimes life-saving health care. Finally, I'd like to close with a quote from Martin Luther King, in which he stated, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. I plead with you to not let our current dysfunctional, expensive healthcare system continue as is. Please, please advocate for the reforms that are so vitally needed. Improve the quality of care to improve access, cover all of the inequities in our current healthcare system."